And your name is?
Kate Henry.
Okay, Kate, tell me a little bit about you. What do you do, and what brought you in the clinic?
I teach Pilates for a living, so I'm standing up all day looking down at clients, and basically I just noticed a lot of lower back and upper back kind of soreness at the end of the day, and I felt like I was a little too young and a little too healthy to be feeling that at this time, so I came into Peak, and it was great.
Right. What made you come in? Like, why did you not just ignore the pain like a lot of people might have, and your clients might have, and so on, right?
Just from teaching as long as I have and seeing a lot of different types of bodies, I know that if something is wrong, you should fix it immediately. You shouldn't kind of wait for it to get worse and worse and worse. And so I could kind of tell, if this wasn't something I addressed now, then it would have been a problem for me 10 or 20 years down the road.
Right. And what was revealed in your exam when you first came in?
Basically that I have forward head posture from looking down all the time, and so my head wasn't aligned correctly, and then I had a slight pelvic tilt, so my lower back was kind of crunched up a little bit, and that was the initial assessment.
Great. And then how did you respond to care?
Great, actually. After the first, few weeks that I came 3 times a week, I started to feel in my daily life that I didn't feel the soreness anymore. Both the adjustments and then having the physical therapy afterward, kind of teaching me what muscles were not firing correctly to keep my bones in line, really helped. And so I kind of noticed habits in myself throughout the day. I knew, if I was looking down all the time, I needed to move that up and really pull in my lower traps and everything. So I learned a lot about my own physical mechanics instead of, constantly focusing on everybody else's physical mechanics. So it was good.
Right. So that brings me to a good question. You're an expert and instructor in Pilates, so some people would say, well, why do I need to go see a chiropractor or do this special type of physical therapy when I'm doing Pilates? Won't Pilates just take care of it?
No. Although I think Pilates is a great exercise program, you need to work on preventative care. And so I think, every body is different and every body responds to things differently. And Pilates is something that you can do your entire life, and it can be something that keeps you fit and keeps your spine aligned and straight. But really, when it comes down to it, if you're having major structural issues, it has to come from doctors and physical therapists.
Great. Anything else you'd like to say about your care? Anything out there from your experience that you've learned?
I've actually taken a lot of what I've learned from Peak and applied it to my profession and my job, and I can see a lot more. I'm a lot more aware of, it's nothing like learning on your own body to really learn about other people. So
excellent. Thank you.
Thank you.